Asthma is a chronic disease characterized by recurrent episodes of airway inflammation leading to bronchoconstriction. Those diagnosed with asthma have a higher risk of developing cardiovascular disease. However, the reasons for the increased risk are unknown. It has been speculated that chronic airway inflammation in patients with asthma may cause vascular impairment and increase cardiovascular risk. This study focused on the novel Mannitol Airway challenge, which, similar to a naturally occurring asthma attack, induces airway inflammation and bronchoconstriction. Thus, the purpose of the study was to determine if acute airway inflammation and bronchoconstriction from a positive Mannitol Airway challenge acutely reduces systemic vascular function in individuals with asthma. We hypothesized that the airway inflammation and bronchoconstriction caused by a positive Mannitol challenge in asthmatics would acutely reduce systemic vascular function. Our primary outcome for the study was flow-mediated dilation, and our secondary outcome was pulse wave velocity. On the first day of testing, 24 confirmed asthmatics completed a baseline pulmonary function test. On a separate day, flow-mediated dilation of the brachial artery, carotid femoral pulse wave velocity, and carotid radial pulse wave velocity were assessed. The participants then completed the Mannitol Airway challenge before each vascular function and structure measure were re-evaluated within 1 hour of the challenge. Salbutamol was given to each participant before re-evaluation regardless of challenge outcome. Our findings show no significant effect on velocity time integral normalized to heart rate, which is an indicator of microvascular function following the Mannitol challenge regardless of challenge outcome. However, before we normalize VTI to heart rate, we do see a significant reduction in VTI. This is consistent with our earlier work demonstrating reductions in vascular function with the administration of salbutamol. Furthermore, our findings show no significant effect on percent change in brachial artery diameter from baseline, which is an indicator of endothelial function following the Mannitol challenge regardless of challenge outcome. The Mannitol challenge also had no significant effect on pulse wave velocity and other vascular measures across all asthmatics. Based on our findings, we conclude that the acute airway inflammation and bronchoconstriction caused by a positive Mannitol challenge in asthmatics did not acutely reduce systemic vascular function. Additional studies are needed to examine the chronic effects of salbutamol on vascular function.